Hey everyone, Adam Fox here for this week's episode of What Does the Fox Say? Want to talk quickly about open enrollment. It is open enrollment for health insurance. It started November 1st. In many states that use healthcare.gov, open enrollment only runs until December 15th. However, here in Colorado, open enrollment runs through January 15th. It's one of the benefits of having a state-based marketplace, Connect for Health Colorado. We can be a bit more flexible and extend our open enrollment period outside of whatever healthcare.gov decides to do. And what I will say is that if folks want to have coverage starting January 1st and avoid a gap in health insurance for private health insurance, it is important to enroll by December 15th here in Colorado as well. You would be able to enroll after December 15th and before January 15th, but your coverage would not start until February 1st. So that means if you wait to enroll until after December 15th, you would essentially have a month gap in your insurance coverage. As usual, Colorado has a network of folks who can help you through the insurance enrollment process and can do so in person or on the phone. And they're sort of distributed throughout the state, so you can find those locations through Connect for Health Colorado at connectforhealthco.com. What we know at this point is that it looks like Colorado's enrollment is tracking a little above where it was at this point last open enrollment period, which is a bit contrary to what we are seeing at the national level, where enrollments are a little bit down from where they were at this point last year. So I think that speaks to both Colorado having its own marketplace and continuing to sort of forge ahead with the system that we've created as much as possible. And I think it also speaks to the fact that the rates here in Colorado are not increasing to the extent that we've seen in previous years, and in many cases people could experience reductions in their premiums, especially those people who qualify for financial assistance. And that, I think, is encouraging some folks to reevaluate their health insurance coverage and hopefully get covered. I think also the message this year is, as usual, but particularly this year, is to shop around. Because of the way the health insurance rates have played out and our Division of Insurance deciding to do what's called quote-unquote silver loading, it means that it's important for folks to really look at their health insurance options and see what makes the most sense for them. The next thing I was going to talk quickly about is are a couple changes that we're hearing about through the Centers for Medicare and Medicaid Services. This is the Department of Health and Human Services that oversees Medicare and Medicaid at the federal level. Alex Azar proposed the other day to potentially allow Medicaid to reimburse hospitals or allow hospitals to use Medicaid dollars to pay for non-healthcare related services, but that may provide substantial health benefits. So this would include potentially hospitals being able to provide sort of rent assistance or housing assistance or nutrition assistance and additional access to healthy foods or things like that. I think this proposal is a good idea. It actually could help address some health equity concerns. As we know, only really about 20% of somebody's health is really determined by healthcare itself. So much relies more on the social determinants of health, where somebody lives, their access to housing and food and safe transportation, and all of those kinds of things play a much larger factor than healthcare in many cases. And so this could encourage hospitals to really start trying to address some of the health disparities and really try to support people experiencing social and economic disparities that impact their health. So I think that's a good development. I think, as some folks pointed out when I posted the article last night on our Facebook page, the devil is really in the details on how that gets implemented and sort of what rules and guidelines are really being implemented by CMS to make sure that hospitals are implementing these kinds of payments in a way that really is beneficial. And it's early phase, so we don't know what this will really look like. This was something that HHS Secretary Azar said yesterday. So it's not, I think the wheels haven't really even started turning on making this reality, but I think it's a promising idea. The other change that we are hearing about, unfortunately, is potentially a change to Medicare formularies in Medicare Part D that could allow Medicare Part D plans to only cover one drug affecting particular conditions in a given drug category. So it means right now they're required to provide two in each category and for each condition if they're available. So that is a concern. Again, those haven't really been proposed. These are just sort of early rumblings of things like that, but that would end up making prescription drugs less affordable and less accessible for folks who are on Medicare. So older adults, as well as some disabled people living with disabilities who may be on Medicare as well. So I think those are a couple things to watch, one good, one bad. We'll see sort of where CMS heads with those. But want to wish everybody a happy Thanksgiving, and also want to put in a quick plug for folks to join CCHI's membership. We were started as an organizational membership coalition, really, and also have individual members who participate in CCHI's work, and it's a great way to really influence the work that CCHI does. You can find information about that on our webpage, and I'll post it in a comment after this broadcast. And just if you have questions about membership, what it really looks like or what it means, reach out to me. I'm happy to answer questions. It's part of my job, so that's what I'm here for. And enjoy the holiday. I'll see you after Thanksgiving.